Good morning once again, and like has been said by my co-compare, my name is Chukwu Emeka Okerafo, and I have the privilege to you see, English is the problem now, to co-compare the event with her. Anyhow, just understand, that's what matters most. Okay, thank you very much, Prof. Thank you, Doc. Thank you very much. We'll quickly go to the next event, the next program here. We don't have time, so I will invite the chair and the co-chair for this segment to quickly come to the stage. Let's put our hands together for Dr. Martin Migombano, Managing Director, FP 2030 NWCA. Round of applause for him as he comes forward. Okay, I don't know whether you were told, at this particular event, clapping is free. You don't have to pay for it. So please, feel free to clap, please. Thank you very much. We also have my pleasure to also invite, well, let me call her my boss, but my boss through my boss, Rudio Diallo, Deputy Director, Gates Foundation. A round of applause for her, please. Please clap very well. There's a reason why you should clap very well. Trust me on this. You're welcome, ma'am. So they will anchor this segment, and after that, we'll come back again and continue the program. You're welcome, ma'am.
Ask question.
How many minutes do we have? It's 20 here. Okay. Shall we? Okay. Good morning, distinguished ladies and gentlemen. Let's say all protocol observed. We are so delighted, my colleague Roger and myself, to moderate this session, which is around country commitments, FP country commitments, the swap, and the focal points. As you have noticed since this morning, we have been talking a lot around commitments, FP commitments. We have been talking about the sector-wide approach, which is, as you know, around institutional framework, accountability mechanism, agreed national policies and expenditures, which actually align with the FP 2030 commitments from Nigeria. Nigeria made 8 commitments in total around integration, access, supply chain, improving financing, accountability, reducing gender barriers, sustainability, and the use of data for decision making. So those are the 8 commitments in general that Nigeria made, which somehow align with the SWAP agenda. And we have, since this morning, discussing some of the progress that this country has made. And of course, moving from 12 to 15 on MCPR might sound little, but I think this is a great achievement already, because there are so many countries which are still struggling actually even to move from 1 point. So a round of applause for Nigeria for this one. So our panelists will be here to talk about, as country focal point for FP 2030, what have they been doing and what are some of the challenges they have been facing. We are expecting from this discussion to celebrate country achievements reflecting on the shared FP 2030 objectives, lessons learned, and action plan from FP 20 focal person in accelerating progress and aligning with the SWIPE agenda. So we have 5 panelists. They have a very huge kind of bio, so I'm not going to repeat all the bio because some of them may take maybe 1 hour. So let me just allow me to quickly.
Martin, invite them to come.
Yeah, sorry? Join. Yeah. I'm just looking for their names. And I won't go through the whole bio because it can be difficult. So we have from the MOH, for the Federal Minister of Health, Dr. Samuel Oyeni. Please, can you join the... Unfortunately, I don't have your bio, but I think most of the people here knows who you are. Secondly, from the USAID, we have Dr. Gertrude Odezugo. She works for USAID, so you can understand there is fund, but there is also innovation. The next one from FCDO, I'm not sure if she's around or is around, Dr. Ebere Anyachukwu. If he's not around, the next one is from UNFPA, Dr. Joachim Chisoke. He has been working for UNFPA for a while now in various capacity and different sectors, specifically on maternal health, but also on preparedness and responses when it comes to humanitarian crisis. As a civil society focal person, we have our own chairperson, Dr. Ejike Oji. Sir, I can't actually read your bio. It's 3 pages, so it's not possible. And I think everybody knows you, so welcome to the stage. Next one is the youth. Do we have the youth in? Felicity Neoma, who is our focal point. She also have a very long CV, so I don't want to repeat it. You are welcome on the stage, Felicity. Where is she? Okay, welcome. So I will hand over to my colleague, Rojo, who will go through the set of questions and discussion with the panelists. Thank you. Over to you, Rojo.
Thank you, Martin, and good morning, everyone. And I think this session is a very good segue after the presentation. Fumi highlight where we are, and we are here with the focal point to really discuss some of those emerging issues, starting by how do we meet our global goal, our global FP 2030 goal. I will be facilitating the Q&A, and my first question will go to Dr. Ejike and Dr. Oyeni. You are tasked to respond to the first question from the audience, which is really, can you share with us if Nigeria is on track for FP 2030 to achieve the goal outlined? And also, what, to your point, are the most significant milestone achieved so far? Dr. Oyeni, and then Ejike. Thank you.
Thank you very much for the question. I would say Nigeria is on track, though slow. We've had the presentation this morning. It's slow. And we're happy we have been able to categorize it yearly, that we need 2% every year to reach FP 2030. But more so, we need to integrate more. I believe if we integrate more, we'll achieve more. Like the BOT chairman said, I think that is the gap we have not been able to do. And we need to do it. And we already have a direction. We already have how to go about it, even in the integration. So we're on track. And with what we are doing, if we put more effort, has been laid down this morning, we are going to meet the target. Thank you.
Ejike?
So, go on
Yes.
with, okay. Yeah,
What can you add to that
okay.
answer?
Yes, the government says we are on track. Let's clap for government now. When we said, I'm glad that Dr. Oyeni did mention that from 2020 to 2030, we needed 2% increase in our CPR to be able to reach 27% by 2030. We're so lucky that we have data now. The snippets coming from the new NDHS that was just completed shows that we have a 3% increase from 12 to 15%. So from 2020 to now is 4 years, isn't it? Now, if you divide that 3, does it mean that we are on track? It means that we're not on track. We're supposed to have added 8%. If it's a 2%, I'm quoting Dr. Yeni now. If we're on track, yes, but the important thing is that we have made some progress, but we must also accelerate that progress. And that's why we are all urging that everybody is a partnership now. It's no more pointing at government alone. And that's why we say is a holistic, comprehensive, I always like to use that word, comprehensive, of everybody being held accountable. How have we held the accountable to donors who give some resources to do this? Are they also making sure that the recipients deliver on their promises before they give them the money? That's part of the accountability system. The government has made a very significant move this year by releasing the $4 million, which will, in terms of financing, we're still not on track. I'll give you the reason. The last minister, Professor Dewole, who is going to be the chair of this conference tomorrow in the opening ceremony, made significant strides by increasing the $3 million the Association for the Advancement of Families successfully advocated for to $4 million and made sure the money was released. But after he left, for 2-3 years, there was no releases. So in terms of finance, we were not on track. But like I said, I like to focus on the positives now. The new coordinating minister, in his wisdom and drive for a better place for Nigeria, has released that $4 million. What is now left is to release the remaining $2 billion that is put in this year's budget.
Okay, Ejike.
Thank you very much.
Thank you, thank you. That leads to my next question to our very able Felicity, representing young people. We know the demographics of Nigeria. We know that if we want youth to thrive, they need to access reproductive health services when they need them. And that is not often the case. So Felicity, can you please share with us the key barriers youth are facing and which is actually a key challenge for us to meet the FP 2030 targets?
Okay, thank you for that question. So for us as young persons and also looking at the data in Nigeria, when it comes to the population of the country, we have over 2 million Nigerians. And it's so interesting to know that over 200 million. And it's so interesting to know that 70% of this population are young persons. So this tells us that this particular group, has the potentials to make the change, to move the needle when it comes to family planning. But unfortunately, we've seen that despite the efforts that have been gained over the years, there are still a lot of challenges that young persons face when it comes to assessing family planning and other reproductive health services, which also has to do with healthcare providers' bias. That is one of the key challenges that every young person faces when it comes to going into the healthcare facilities to seek for family planning services. Is either, that faced with judgmental attitudes from the healthcare providers, which hinders them, because when we are out there creating demand for these services, and when young persons eventually go to access these services and do not get these services because of the social norms that also affect or hinders the healthcare providers providing services. Another thing which also shows the capacity gap in terms of provision. And then another challenge too that we face has to do with funding for young persons. So when you look at youth-led organizations that are doing wonderful works, especially in the grassroots areas, there are a lot of persons that are implementing innovative initiatives that is targeted or geared towards advancing family planning for us as young persons. But unfortunately, we don't have the capacity in terms of funding. Because most times when we look around, we've been talking about funding for family planning, right? If we don't have the funding, we'll not be able to achieve our targets by 2030. So we need to be very intentional to also ensure that youth-led initiatives thrives. That also means that being intentional to supporting young persons, youth-led organizations that are working in the grassroots areas, ensuring that those young persons that are in hard-to-reach areas gain these services.
Thank you.
Thank you.
Thank you very much. I think youth-centered services, but also just reminding our healthcare providers who are members of the community that family planning is a right, doubling down on right-based family planning is urgent to meet the needs of young people. My next question goes to our donors and partners. Can you, while we celebrate successes, can you share with us the innovative practices that have shown promise in the programs you support at the national or subnational level, or both? Gertrude, and then next we'll go to Joachim.
Thank you very much, Rodio. First of all, I'd like to say kudos to all of us for moving from 12%, 15%, can you hear me? 15% MCPR. And the bravery we are as a country that we want to achieve 27% by 2030. And like every other person has mentioned, including Dr. Fumi's presentation, we have seen that we still have a long way to go. First of all, I'd like to commend us for trying to allocate at least 1% of national and state health budgets for family planning. And like Saraki mentioned today, it is important that beyond what the funding that is coming from national level, the states have the responsibility to ensure that they are allocating funds for family planning. And so we have seen states do that. And that is one innovation that has proven to be successful. We have data that shows that states are committing funding into the UNFPA baskets for procurement of commodities. We have a few states that have family planning, reproductive health services budgeted for in their annual operational plans. And then taking it down to programmatic level, beyond what we have done over years in training healthcare providers to be able to and have the confidence to provide long-acting reversible contraceptives. The data also shows that the divide between rural and urban is reducing, because while MCPR was increasing in urban areas, it was also increasing in rural areas, though we still have a long way to go. So what it means is that it's possible that the innovation of using mobile health clinics or having community outreaches for family planning might be working. We have also seen the impact that our tax shifting and tax sharing policy has led us through. I would not say everything so that my colleague will have something to say, but including the services that are provided at private facilities or private PPMVs and community pharmacies goes a long way. So I think it was Felicity that mentioned, or somebody mentioned about how 60% of clients will first of all go to the private centers. And now we're not talking about the health facilities in urban areas. We have PPMVs that are sitting beside many of these homes in the communities. So we have been innovative. We have been trying to scale up high impact practices. We have tried to expand the method mix. It's working, but we need to do more.
Thank you. Joachim?
All right, thank you so much, Rodio, for that question. So let me say that when you look at the FP 2030 commitments of Nigeria, we actually have 8 objectives, commitment objectives, like Martin mentioned. We also have a whopping 26 milestones, and all those milestones are linked to a lot of activities. So for UNFPA, what is important for us is to try to prioritize interventions that would actually indeed be innovative, like you mentioned. And I'd like to share a few. First and foremost, one of the innovations that has worked very well is smart advocacy approach to domestic resource mobilization. We believe that sustainable financing is one of the most critical issues that we need to deal with if we're going to be successful in attaining our FP 2030 goals. So rolling out sustainable smart advocacy interventions at national and subnational levels has proven to be quite successful. That led to the release of the $4 million that Dr. Ejike mentioned. It also unlocked financing a match fund. So another important innovation would be introducing initiatives like the match fund, which enables the government to also easily key into sustainable financing interventions. We have last mile assurance processes. This helps us to strengthen the supply chain, which is also a very big issue for us if we will get it right. And maybe finally, I would also mention that interventions around ensuring that the policy environment is enabled. So policies like the total market approach strategy that we've supported the government to develop are also very promising. And lastly, I'll mention private sector engagement. We've recently seen that there's quite some good promise when we engage with the private sector to even fill some financing gaps to make FP 2030 commitments and to enhance service delivery. Thank you.
Thank you, Joachim. I had a warning from the MC, so I have one last question that we invite each of you to answer in half a minute. So we start by Dr. Oyeni. If you can just share regarding the roadmap to FP 2030, and as a focal person, what is the 1 or 2 things that we can do to accelerate progress?
Okay, thank you very much. One of the roadmap that I want to share is the integration of FP with MNCH.
Okay.
If we want to seriously achieve it. And maybe we can change the narrative a little bit. We've attended a lot of conferences on the postpartum family planning, for example, post-abortion family planning. There is a need to look at the direct relationship between FP and the reduction of maternal mortality in terms of postpartum and post-abortion care.
Thank you.
If we want to seriously achieve it.
Thank you.
Just 30 seconds, please. You see, if you look at the maternal health complications for postpartum, PPH, pre and eclampsia, the unsafe abortion, these are the major causes of maternal mortality. And we need to look at it. When a woman has any of these things, should we still do by choice? I don't want family planning, or I want. It has to be integrated. The choice can be by choice, the method. But when we look at these maternal health complications, and we want to really use family planning as a direct tool to reduce mortality, we need to find a way of integrating appropriately. And what do I mean? A woman that has PPH in Nigeria today, in many of the facilities, either primary, secondary, or tertiary, after counseling, some of them will say, I don't even want family planning. And within 6 months, some of them can be pregnant and come back. And PPH is 23% of contribution to maternal mortality.
Yes.
And
Dr. Oeni.
eclampsia is also on the increase.
Yes.
So there is a need to seriously integrate family planning into MNCH.
Thank you.
So that we can meet up.
This is great to hear, because it's the federal ministry designing the policies, enforcing also the policies. So we will follow up with you on that, but we have your word. Ejike, you have half a minute.
Hello.
Felicite.
Yes, I just have two things to say. One is financing. If we can just make sure that there's appropriate financing, and that's why I'm a fan of the total market approach. Like Joachim mentioned, the Federal Ministry of Health had developed that strategy. The second thing is to make sure that we implement it so that we have appropriate financing for family planning. I'm glad the Basic Health Provision Fund resources have been integrated to make sure family planning gets to marginalized groups. The second one, just to support what Oyini had just said, high impact practices, that is the best way to get service delivery to people. And then I remember about in 2003, I made sure in all our sites while I was at IPAS that postpartum family plan and post-abortion family planning. And then we saw in one state an increase of almost 8 percentage points. And that is I always say, is the best missed opportunity to make sure that a woman who has never been exposed to any healthcare sector or healthcare facility, coming for postpartum hemorrhage or coming for post-abortion care or even delivery, that is the best opportunity to integrate services and give to that woman.
Thank you, Ejike. And you will be following up with Dr. Oyeni on that.
Okay, so I just have how many minutes? A second, okay? Okay, so I would just recommend that going forward, if we want to achieve our FP 2030 goals, we can adopt, we have an adolescent and youth strategy, FP 2030 adolescent and youth strategy, which has 5 pillars. So I'll be mentioning that. So one, like Dr. Ejike and Dr. Oyini also mentioned about showcasing high impact practices, especially for adolescents and youth. Secondly, has to do with prioritizing adolescents and youth programs. We have to be intentional about that, looking at the population as well. We have a very youthful population. And then secondly, championing youth leadership is very important. And then data. Data is very important for us to be able to make decisions, for decision making. So we need to have more disaggregation of data for adolescents and youth indicators to help us in terms of our programming in our country, both at the national and at the subnational level. And then finally, I also mentioned about building allies. So most times we as young persons, we don't always have to be at the table every time. But when we have allies, as all of us in this hall, I can see, yes, I can already see some of the allies that we have building, some supporting adolescents and youth programs. So we need to also, build on that. Thank you.
Thank you. Joachim, and then Gertrude.
Okay, all right, thank you. So our roadmap must address 3 issues, which are sustainable financing, supply chain strengthening, and sustainable financing, supply chain strengthening. No. Okay, and then we must take advantage of 2 opportunities, which include the national blueprint, which needs to be revised, and the sector-wide approach. Thank you.
Yes, I'll be very brief. Dr. Oyeniyi, the JAR report, family planning only appeared once there, and it appeared where we're discussing something about community health approaches. I think that's an indication of where our heads are at, and so if truly we are serious about integrating family planning into MNCH, the country needs to show that we understand that family planning is key to reducing maternal and child mortality and morbidity. That said, there's an opportunity, of course, and because a lot of us, you inclusive Dr. Oyeniyi, there where disbursement-linked indicators are discussed. So in talking about, how funding should go to the states and the kind of funds that come from states, we should be seated there and helping states figure out what indicators for family planning should be put in those disbursement-linked indicators. That way we can almost be certain that when funding comes out from wherever, some of it will go to family planning.
Thank you, Gertrude. I was given permission to take 1 question from the audience before passing on to Martin. So the first hand here, sir.
Thank you very much. Good contributions from the panelists. As I listen across the discussion, I can pinpoint a very important factor that we are missing, and that is the importance of rewards as incentives. I think we need to wrap around some governance leadership reward system for family planning improvement across the states. We might be surprised to see that the governor at sub-national level will rise up to this. So let's also consider that as an important factor. Thank you.
Thank you, sir. I think that's a very, very good point. For the sake of time, I will pass on to Prof. You want to say something? Yes. So this is the last intervention before. And then Martin, after Prof.
Thank you very much, dear Lo.
Yeah,
I'm compelled to speak because there's no recommendation they've said on this platform that we've not said for many years. And my response to the initial question, are we going to meet the target? It is capital no. Capital no. But if you want it to be yes, and I keep repeating this, ladies and gentlemen, you have to evangelize family planning. From the airport to this place, how many billboards do you see on family planning? What type of billboards did you see? The church, the brewery. And these are successful industries. So how are they doing it? How is the beer, Coca-Cola getting to the creeks, the remotest place of this country? Where are people buying those products? Because they need it. So going forward, if you want to achieve it, do what those industries are doing. You need immediate transformational messages that will mobilize the community to want the product. The benefit is reduction of maternal death, improved health care. You understand what I mean? They all know it. And let me also say, family planning is not an imported idea. You have to let the people know it. Our forefathers have been practicing it. The methods they were using are the prototype of modern methods. But you must get the information to the people, especially those in the communities. You must mobilize the communities. And I think the traditional means of communication will be effective. Yes, all the imams, the pastors must be energized to talk about family planning at every opportunity they meet with their crowd or their members. Going forward, if we are to meet it, I want every day, there must be a message on all the media houses about family planning. What is wrong in attaching condom to a bottle of beer?
Thank you.
Mikai did this in Thailand in the late 70s. Condom rings, condom cabbage restaurants. These are innovative ways, but most importantly, the youth. Because of the youth bulge, you need to involve the youth. We have enough policies, beautiful policies, ladies and gentlemen. Let's not even go to policy arena. The policies are there.
Thank you, Prof.
Engage the youth.
Yes.
Not only in programming, but in advocacy. We have examples. I told somebody yesterday about the Mudafem project in Ibadan University. It is the youth themselves who saw their colleagues dying, who initiated that project. You had representatives from every hall of residence trained on family planning, giving leaflets.
Thank
They
you, Prof.
provided counseling to their peers. They provided non-prescriptive family plannings, and they referred others to UCH.
Thank you, Professor. Thank you so much.
Thank you, Prof.
You need to do that.
Thank you, thank you.
Ladies and gentlemen,
Thank you.
I want to see a billboard. If you are not using contraceptive, zip up.
Thank you.
Thank you.
Thank you, Professor.
Thank you very much. I think we have our slogan, so let's just mark it down and live by the slogan. Martin, over to you. I know we are above the time.
I'm not going to take a lot of time, actually. I think all have been said. I think what we have been emphasizing on is around resources, findings. And as we were noticing, the SWAP also are talking about expenditure. So I think this is really a line between what is missing currently and what is needed. We have been talking about national policies. We have been talking about accountability mechanism. We have been talking about institutional frameworks. There are some which are already existing, but maybe poorly being implemented. So I think the panelists have highlighted, they have highlighted the roadmap, the importance of the youth. 70% of Nigerian population is below 30 years. So those are important things. And finally, I think what the Prof has just mentioned, evangelism. And I think those are practical ideas and action that need to be done. And discussing about family planning shouldn't be something that people will go at the corner and discuss because they are afraid. Wherever this is happening, it has to be discussed openly, everywhere, with everybody. I think that is the strongest message we may take out from this panel discussion. We are quite delighted and thank you for your attention. Thank you.
Thank you very much.
Thank you. So we'll have group photograph now of the panelists and the chair and co-chair. More people. Thank you very much. A round of applause for them as they go back to their seats. Thank you very much.